Hi, this is the Dr. Paul Show. I want to talk a bit briefly about addiction, a common problem we see in our society. I talk about this in my new book, The Corona Protocol. I have a whole chapter on addiction, and I tell a story about a guy who suffers with addiction. But addiction is, in so many words, is self-medicating. So what's the difference between someone who can do things recreationally or social drinking? For example, I mean, I like beer, okay, but I just drink here and there. I don't overdrink. And so, but there's a difference between that and taking it so far where you become an alcoholic, where you're drinking like every night. There's a difference between a glass of wine at night and a bottle of wine at night. There's a difference between one or two or three beers and 12 beers. And then that's just alcohol. And then, and then it's even more with addiction with alcohol. It gets more with the hard alcohol. Number one is vodka. Vodka is of all the alcoholics I've seen in patients, that's the number one problematic. Why? Because it's easy to mix with other things. Yes, you're going to see it with other bourbon and tequila and other hard liquors, but vodka is probably number one, really. And then that's alcohol. And how about other addictions? There's a lot of them out there. I mean, marijuana, some people do it a lot, way too much, every day, every night. They live on it, and they say, well, this is my medication. This is what I use as my medication. So if it's a primary medication, that's not a good situation, because if it helps a person, that's one thing. But a lot of these things can help people, because people will say the same thing about alcohol. Well, when I drink, I feel better. I'm more relaxed. And true, there is a point to that for sure. But the thing is, then, and nowadays we don't, we have smoking, we have nicotine in different forms now. There's cigarettes, there's also the vaping now is a big thing. Patches, gum, chewing, whatever. So tobacco is nicotine is probably one of the most, if not the most difficult one to stop. And of course, we have a lot of the new things that are out. The opiates are highly addictive. There's the pain pills, and then there's the street opiates like heroin. Nowadays, it's all fentanyl. It's even hard to find heroin anymore because fentanyl's taken over, and that's very deadly. Most of the deaths of drug use are fentanyl. And not only that, the other thing we have to be very careful about, a lot of the street drugs that people buy, let's say even people are buying a street opiate, they think it's Vicodin or Norco, and it's laced with fentanyl, and they take one pill and they die. And we're seeing a lot of fentanyl deaths, so hundreds and thousands of deaths over the years from fentanyl. And we're even seeing cocaine laced with fentanyl. We're seeing, so we're seeing other street drugs laced with fentanyl. So very deadly. If you try to find, or even benzodiazepines like Xanax, things like that can be laced with fentanyl. So you never want to buy any medication off the street. If you're ever going to get any medication, if you don't get it from the pharmacy, do not take it, because you just never can tell. It can be deadly. But addictions can come in all forms. A big one also is methamphetamines now, a very dangerous drug. And again, what leads to addiction is an underlying mood disorder. So typically people aren't going to get addicted to something unless they're self-treating, unless they're trying to lift out of depression, reduce their anxiety, get rid of their mania, calm their brain down. So that's what gets people into it. And the problem is, once they're into it, it's just very difficult to stop. And in the case of opiates, try stopping that and you have severe withdrawal effects. Try stopping nicotine and you get anxious and jittery. And then as soon as you have that cigarette, you calm down. Drinking, the same thing. You stop drinking when you've been drinking really heavily, you start getting shaky. You're at risk for seizures. So there's risks for these things. There's major risks for getting addicted to things, because then you get trapped and you can't stop. So, but it's a serious subject. Like I said, if you want to read more about it, you want to check out my new book, The Corona Protocol, get a little bit further into it. And if you, like I said, if you like this video, please like and subscribe and share with a friend. And if you have any questions or comments, please, I'll try to get back to every question that's asked of me, or any comment that's sent to me. I'll get back to you about it. And I'm also, I deal a lot with addiction in my practice, so I'm also available to be seen in my office or virtually, or we do phone visits also. So yeah, if you need help, just please like, subscribe to this video, share with your friends, and thank you for listening.